Today we will discuss CPR or basic cardiac life support. I am Dr. Asifullah. I am Associate Professor Cardiology at Khyber Medical University. So, a medical doctor should always know how to resuscitate a patient in emergency. Whatever specialty patient, you should know the basics. Safety first. Local experiences have taught us that we should have a allocated room or team in ward premises. We should allow for 20 minutes resuscitation effort before declaring any patient as dead. Meanwhile, we should have good communication amongst the staff and mutual respect of the patient, attendants, and staff. Cardiac arrest occurs when the heart malfunctions and stops beating. Sudden cardiac arrest occurs without warning or within minutes after symptoms appear. Heart attack is a different thing. It is not same as cardiac arrest. Heart attack is different from the cardiac arrest because in cardiac arrest there is a rhythm problem which will lead to mechanical malfunction. But fast action will always save lives. If you see anyone unresponsive and gasping in seconds, they are probably going to be dead within minutes. Heart attack, on the other hand, is a clot problem. The patient may have chest pain, shortness of breath, cold sweating, nausea and vomiting, jaw, arm, back, neck pain, and lightheadedness. In women, aspirin, ticagrelor, atorvastatin, and enoxaparin could be used as initial resuscitative medication for this problem. All cardiac arrests are not due to myocardial infarction, but most of the cardiac arrests are due to myocardial infarction. Basic life support sequence is basically chest compressions with airway care and breathing. You verify scene safety, then check for responsiveness and establish the victim is unresponsive. Shout for nearby help and activate the emergency response via mobile devices if appropriate. Get automated external defibrillator and emergency equipment or send someone to do so. You check for breathing and pulse. You check for pulse for 10 seconds, and if you know that there is normal breathing and a pulse, you monitor the patient until emergency responders arrive. If there is no normal breathing but victim has a pulse, provide rescue breathing by giving one breath every 5 to 6 seconds or about 10 to 12 breaths per minute. Check the pulse about every 2 minutes. If there is no breathing or only gasping and no pulse, begin CPR with cycles of 30 compressions and 2 breaths. Use the automated external defibrillator as soon as it is available. Surveillance, prevention, and treatment of pre-arrest conditions is the most important thing while on rounds and in the ward. You will activate any emergency response system that is available to you to get the help for resuscitation. Early CPR save lives. Do not delay the CPR. Early defibrillation as soon as available should be implemented and used. And the post-cardiac arrest care for reversible conditions and the conditions which led to the cardiac arrest is a very, very important part of the cardiac arrest resuscitation care. That is it for today. We will move on to the next part in few days. Thank you for listening.